Hello, my name is Aaron Petra. I'm a physician assistant working at the Institute for Minimally Invasive Spine Surgery here in Holyoke, Massachusetts. I work alongside our medical director, Dr. Pennings, and physician assistant, Michael Bennett. And today we're going to be talking about the minimally invasive anterior cervical discectomy infusion. Some common indications for surgery. So on the left-hand side here, you'll see an example of cervical nerve root compression. You can see the red arrow pointing towards the nerve that's being compressed. Typically, this happens as a result of disc herniation and can be accompanied by fairly severe arm pain. In the middle, you'll see an example of a vertebral body slip, also known as a spondylolisthesis, where the bones are actually slipping out of place, pulling the cord to the side and distorting it, causing spinal cord compression. On the right-hand side, you'll see an example of spinal stenosis. Now, this is a fairly severe case of spinal stenosis where there's cervical spinal cord compression. And if you can see that change of color that the arrows are pointing to, that's actually an indication of nerve damage, of spinal cord damage as a result of this long-standing compression. Some potential benefits of surgery. So resolution of severe neck pain, resolution of severe arm pain, resolution of numbness and tingling in the hands or arms, which is dependent case by case. In some cases, numbness can be a sign of nerve damage versus nerve compression, so it's difficult to adequately predict to what extent these symptoms will resolve. Improved strength is often reported by our patients after this surgery. And sometimes the surgery is performed to halt worsening symptoms of myelopathy, so severe spinal cord compression like we saw in this previous slide. Some example of symptoms that occur as a result of myelopathy are issues with weakness, balance issues, fine motor movement, dexterity, and others. The expected hospital course. So you'll arrive the day of surgery here at Holyoke Medical Center. You'll check in with our preoperative department and you'll meet our nursing staff. You'll meet Dr. Pennings in the morning before surgery and sign a surgical consent form. You'll be able to ask us any questions that you have related to the procedure prior to going under for anesthesia. You'll meet our anesthesia team, be put under general anesthesia for surgery. And after your surgical procedure is complete, you'll wake up in our PACU, our post-anesthesia care unit, and our anesthesia team alongside nursing staff will make sure that you're stabilized before you're discharged home. For the surgical procedure itself, after you're intubated, you're positioned on the operating room table on your back. We sterilize the surgical site, so the front of the neck, with iodine. A timeout is taken to confirm patient information and review the proposed procedure. Dr. Pennings will then make a small incision through the skin and the platysma muscle. He'll localize the anterior cervix or the front of the spine and remove the disc material at the levels that you're having surgery. After the disc material is removed, an interbody spacer is placed between the vertebral bodies, as shown on this image on the left. This is done through the same incision that Dr. Pennings made to remove the disc material, so you'll just have one small incision on the front of your neck after surgery. After the surgery is complete, and we're able to identify correct placement of the interbody spacer via x-rays taken in the operating room, we'll place sutures under the skin that will dissolve on their own, so you'll have nothing on the surface of the skin that will need to be taken off. You'll have some steri strips placed over the incision that should stay on for about a week. Typically, they fall off on their own, but if they don't, after about a week, you can remove them yourself. For recovery and follow-up, we ask all of our patients to observe around an 8 to 12 pound weight restriction for the first 4 to 6 weeks after surgery. This does vary case by case depending on what patients are going to return to doing after surgery. We ask that you limit overhead activity, lifting, and twisting of the neck. These are more so for comfort and to not protract the healing course. We ask that you stay active, walk as much as you can, and get back into regular activities of daily living slowly. You can utilize over-the-counter medications such as Tylenol or ibuprofen alongside the narcotic pain medications we'll prescribe after surgery for your pain. And we'll follow up with you after surgery in about 2 to 3 weeks in clinic. Thank you for taking the time to watch this video on the minimally invasive anterior cervical discectomy infusion. Please feel free to reach out to our office and schedule a follow-up visit if you have any questions. Thank you. Bye-bye.